Everyone, my name is Jay Otto, and I'm a researcher with the Center for Health and Safety Culture, and I'm joined by Katie Dively, who's my colleague. We're going to be talking about tips to grow traffic safety culture. Both of us are going to contribute to this presentation. This session will be recorded, so it will be available in the future. If you want to listen to parts again or share parts with somebody else, it'll take a couple of days before it comes up on our website. On the next slide, we can learn just a little bit about WebEx. I think we've all gotten familiar with these different technologies. You have a menu choice at the bottom where you can adjust your audio. If you need to switch kinds of audio, that's gotten much better, so hopefully you don't have to deal with that. You do want to look for the chat box. That will be an opportunity for folks to share information, and we'll be doing some activities where we'll look at that. So if you want to find the chat box, that should come up. Either it's on a panel on your side, or there's a little bubble at the bottom where you can choose to open up the chat. At the center, our research is about exploring how culture or shared values and beliefs influence decisions, actions that impact health and safety. We're an interdisciplinary center. We have folks with a wide variety of backgrounds. We also think it's extremely important to bring out to community, to bring out to practitioners that which we're learning. So this is an example of doing webinars and things like that. We also do a fair bit of training and something we call guide service or guidance, where we engage with sponsors for a continued amount of time working side by side with them on their issues. All of our research is very applied. Sponsors we often have some federal, state, and community level sponsors all trying to move the needle on very real issues. At the center, we do a lot of work around traffic safety. We have historically also done a lot of work around preventing the misuse of substances and continue to do quite a bit of work there. We also do some work in the context of addressing domestic violence or interpersonal violence and aspects of child well-being, reducing child maltreatment, issues around that. So with that very brief introduction about who we are and a little bit of what we do, I'd like to turn it over to Katie to start talking about the first tip.
Absolutely. All right. So as Jay shared, we are going to be talking about tips to grow traffic safety culture. We find in the work that we do at the center that these ideas are just really critical and instrumental in improving traffic safety and growing a culture where health and safety and traffic safety related behaviors are really sustained long term. So let's just dive right into our first tip, which is to raise concern and hope. So let's break that down. Let's start talking about concern first and to define that. So here are two different definitions, similar definitions of concern. The first one is to have an influence on. This problem concerns us all. Impaired driving concerns us all, as an example. The second definition is to be a care, trouble, or distress to. Her health concerns me. Perhaps, his not wearing a seatbelt concerns me. So you might be starting to think to yourself, well, why raise concern? Why is that important in the work that we do in traffic safety or in any health and safety field, really? Well, we raise concern because we really need people to engage, don't we? We need our audiences to engage. We need them to start maybe paying attention or learning or even shifting their behaviors. But that all starts with engagement. And I say our audiences, and yes, that might be the audiences whose behaviors we're trying to reach with health and safety behaviors, but also our stakeholder behaviors too. And so we don't want to forget about them, right? Because we need our stakeholders and our partners to engage with us. And we do this by raising concern. And I think that we're pretty good at raising concern in our work. I think we're good at doing this in public health. And yet there are times that we might cross the line into something that's a little bit different than concern, to a place of fear. This slide shows a fear-based strategy or a scare tactic type of approach that Jay and I do see taking place in some of the communities or groups that we work with. And this is a mock car crash. And it shows sort of the aftermath of a car crash where someone has been killed or even seriously injured from perhaps drinking and driving or distracted driving. Often these events take place like in a high school parking lot where they reenact kind of what happens as soon as the crash takes place. It's quite an intensive experience, and we often hear from the coordinators that are engaged in this type of strategy that it was really effective. And so we tend to probe on that a little bit. Well, why or how was it effective? And they'll say, well, the kids were so distraught, or boy, everyone was crying. Well, is that what we consider effective? Is that what we want? We want people to be distraught or kids to be crying. I don't think so. I think we can do better. I know that we can do better. And it does bring me to this question, though. What if we want to raise concern and we really don't want to go to that point of fear? What is the difference between concern and fear? What would you say is the difference between concern and fear? Put this in the chat window. Now, I'm seeing that we might have some chat window issues. Is that right? So I think you might be able to respond to the panelists, which is, we'll see that, Jay and I will see that, and we'll read your responses out loud. So please do chime in with what you believe to be the difference between concern and fear. Good. Okay, so we have one, feelings of efficacy to change outcome. Yep. Any other comments? Yeah, a level of emotional response is different, right? Between concern and fear. Somebody put the fear is about control. Any other comments here? Concern raises opportunity to choose. Fear seems situation is inevitable. Isn't that interesting? We often hear that, right? Concern sort of prompts thinking. Whereas fear might not. Fear might at times paralyze us and just make us want to get out of that situation quickly. Any other comments here? Differences between concern and fear? So we really do feel that there is a difference between raising concern and sort of prompting and eliciting these feelings of fear and being scared. And I think a question that we want to be asking ourselves as we engage in our efforts to improve traffic safety is sort of, what are the unintended consequences or adverse effects that can come from the work that we do? And often we find that in fear-based strategies or scare tactic types of approaches, that they can have unintended adverse effects. They can label and stigmatize. We work really hard to avoid creating stigma and creating stereotypes, because we know that once these stigmas are established, it can result in individuals being feared, being avoided, and definitely reduce the likelihood that they're going to seek supportive services. They can expand social gaps in our communities. We know that at times, unintentionally, our health communications may reinforce rather than reduce disparities that already exist in our communities. And we absolutely want to avoid that. And promoting poor health as a value. I think it's interesting for us to start thinking about how we talk about health and how we talk about people who are not in optimal health or people that are not engaging in the behaviors that we hope that they were engaging in. What does it look like as a community if we're engaging in these fear-based strategies or we're putting these fear-based, kind of scary images and messages throughout our community? And so I think these are really important consequences that we want to think about as we engage in strategies to improve traffic safety, to grow traffic safety culture. And I would say another really important thing that's not on this slide but is illustrated in the research is that fear-based strategies, while they do elicit this immediate response often from individuals, it's really hard to sustain that reaction over time because, once you scare somebody once, you sort of have to up the ante a little bit. You have to scare them more the next time to keep them engaged. And at what point have we sort of upped our level of scariness that we're scaring people so much that they're leaving the room and maybe missing our message entirely? Or at what point do we become sort of this less credible or less trustworthy source of information? And we know once we lose credibility or trust within our audiences, that can be really, really hard to recover from. So we really, really want to avoid doing that. Humiliation, shame, guilt, and angst are not the primary engines of change. And these are often the feelings that come from a scare tactic type of strategy. Ironically, such experiences can immobilize the person, rendering change even more remote. Our work to grow traffic safety culture is all about change, right? It's trying to grow positive change for individuals, for groups, for communities, for different systems. Creating this sense of humiliation, shame, guilt, and angst moves people in the opposite direction and makes our work, which is already really hard, all that much harder. So if we can raise concern without crossing into that sort of line of fear, we can really engage people and have greater impact. So I said this first tip was about raising concern and hope. Let's talk about hope for a minute. What do we mean by hope? Well, this is one definition of hope, which is first, let me just say that hope has a whole lot of research behind it. I think we often miss that. I think that we can say, oh, it's just some kind of happy go lucky notion, when there really is a lot of research behind the impacts of hope. Here's one definition: it's the perceived capability to derive pathways to desired goals and motivate oneself via agency thinking to use those pathways. So there's really two components that I want to pull out from this definition. First, it's that willingness to move forward, sort of that motivation, the will. And second, there's that seeing of that path forward, the way. It means I have that motivation, that willingness, and I also see that path forward. When we have hope, that means that we're in that place to move forward. We have that energy, we have that willingness, and we see that path forward. And if you don't have one of these, right? If we don't have the will or the motivation, or we don't see that path forward, we can get stuck and we don't act. So I'm going to ask that same question that I asked earlier, sort of why raise hope? Why would this be important in the work that we do? Well, it's because we need directed engagement. We've got people engaged from raising concern, right? Now we want to direct that engagement, giving them that path forward towards healthier, maybe safer behaviors, towards solutions. And I'd say we also need energy for this work. I think our work requires a lot of engagement and a lot of energy over time. Our work in changing behaviors and growing traffic safety culture can take a long time, and our engagement and our energy are needed from our audiences and our stakeholders ourselves as well. So we also need energy, and that can really be a byproduct of hope. So what does this look like? What can this look like in our work? How do we raise hope? Well, I would say, to start, I think we can start to look at sharing some of the protective beliefs and behaviors that already exist. And perhaps you have some data that looks like this around the issues that you're working on. For example, most people wear a seatbelt. Most people want the people they care about to use a seatbelt, right? Kind of growing that that shared culture, those shared values and beliefs. Most people agree it's the driver's responsibility to ask others to use the seatbelt. And as we'll talk about in a little bit, we can have really differing beliefs about what we think others are doing. So, starting to portray what most are actually doing in your community can really help generate hope for the issues that we're working on. What I'd like to do now is I'm going to share with you a short little video. I think that this video is does a great job of both capturing hope and concern. I'm having an issue with audio today. It's fine. There are no words in the video. There's just soft music, so you're not missing anything. But just watch the video. A great video and a message came through that said powerful, even more powerful with the soundtrack. I couldn't agree more. There is some great music that goes with this. Unfortunately, I think we had a shift in WebEx. It doesn't allow me to share the sound with you. So I apologize for that. You can look up this video if you do want to see it. It is called the Embrace Life video, and you can find that on YouTube. It's just I think does a great job of helping us understand that we can grow concern. We saw the concern in this video, and also portraying hope, that family coming together, creating a seatbelt around him, that hope that seatbelts do save lives. So just a really great video. So coming back here, just to wrap up this first tip, which is that we really want to work to grow concern and hope. Growing concern, like I said earlier, motivates change. It motivates action and for people to become engaged. And hope is really what gives us that path forward. So I'm going to turn it back over to Jay here, and Jay is going to go through our second tip.
Great. Thanks, Katie. So to get us thinking about the second tip, I'm going to ask you 3 questions. This is going to really require you to use the chat. So make sure when you chat, you just say to panelists. And then Katie and I'll be reading out some of the responses. So when we think about working in traffic safety, when we think about your efforts to improve traffic safety, what are the consequences you are trying to reduce or eliminate? What are some of the consequences? Put those in to the chat window. Yeah, certainly death. We have that come up right away, right? We towards zero deaths as a goal and a vision. Injury for sure. Pain certainly, and we can think about pain both in terms of people involvement and injury, but we can also think about emotional pain, the scars of somebody dying and the impact on their family, the trauma that has. Certainly damage. There's a lot of property damage. Vehicle damage, that has a lot of cost. Tremendous loss and financial impacts when we think about the cost to our healthcare system, to everybody's health insurance, workers' compensation rates. Yeah, so interesting. A lot of different ideas on consequences, and I think we're pretty good at looking at those. Sometimes folks aren't necessarily looking out totally beyond injury, but there are a wide range of consequences. All right, let's go to the next question. And what are behaviors that lead to these consequences? So what are some of the behaviors that lead to these negative consequences? Yeah, so we know something like speeding, not wearing seatbelts, impaired driving, distracted driving. These are all ones that come up as major components. Now, I'd also like you to think about, what about behaviors beyond road users? What are some behaviors of other stakeholders besides road users that contribute to these consequences? We might think about vehicle design, the degree of safe vehicles. We may think about vehicle traffic. We may think about interacting with high degrees of commerce, larger vehicles, very heavy vehicles. But I think we also want to think about things like, what about the decisions that we make in terms of road design? What about the decisions that we make in terms of separating modes and investing in different modes? So do we invest as much in our pedestrian access as we do in vehicle access? Or do we separate them well? What are the behaviors that workplaces have about establishing policies or training others? What are decisions that parents make about training their children to be safe road users and ultimately drivers? So we can think about a wide array of behaviors. Often we get stuck thinking about just road user behaviors, but we really want to encourage you to think beyond road users. There's a whole litany of other behaviors that impact these consequences. And then finally, the third question is, or what are some of the beliefs that you think support these behaviors? Now, some of you have mentioned them already, sometimes a sense that like it won't happen to me, or components like that. But what are some other beliefs? Yeah, just this once kind of risk taking. It won't happen. I'm a better than average driver, right? I'm a safe driver. We all live in Lake Wobegon, where everybody's above average. So we can have a variety of different beliefs that can support these behaviors. And really what I want you to take from this is, first, just starting in your own mind to discriminate between consequences, behaviors, and beliefs. And then starting to see an association between these. Clearly, as Katie said, if we're going to try to change the consequences, which is all of our work, we're going to have to change behaviors. And that is behaviors of road users, yes, but many other players too when we think about a safe system approach, right? We want to think about safe vehicles, safer speeds, safer road designs, safer decisions about investing finances in our road transport system. So there are a wide array of behaviors, and all of those behaviors are supported or sometimes inhibited by various beliefs. And so we can think about our work as trying to influence those beliefs to grow safer, better behaviors, leading to better consequences. So what I want to do as the second tip is to help you think about your work to improve traffic safety as really about changing beliefs to change behaviors. And it's interesting when you start to think about your work that way, and when we think about these beliefs as underlying our traffic safety culture. So what do we mean by beliefs? Well, there are a lot of different kinds of beliefs, and we're going to explore three buckets of beliefs today: behavioral, normative, and control. And this is just going to help our understanding of broadly three kinds of beliefs. But I've done a lot of review of different sort of behavioral models, and behavioral models is the science of understanding beliefs and their influence on behaviors. And really, a wide array of beliefs tend to fall into these three big buckets. So what do we mean by these? Well, let's look at the first one, behavioral beliefs. So behavioral beliefs are expectations about engaging in a behavior, and they'll influence my attitude about the behavior. So they're very much about what the behavior has benefit to me. In other words, like what's in it for me. So for example, I might have the belief I can dance better when I drink. This is a positive expectancy that I might have about drinking. If I drink, I can dance better. Now, it's critical to realize the belief may be false, right? My friends might tell me, look, you do not dance better when you drink. But even if I think I do, that belief may lead me to be more likely to drink. We can have negative expectancies, like I don't like getting sick when I drink too much. And for any behavior, we'll have lots of behavioral beliefs, and we'll weigh them in a certain context, and we might weigh them differently in different contexts. Now, in traffic safety, we can look at some examples like about 8 out of 10 people believe that driving while holding and talking on a cell phone was very or extremely dangerous. So that's good. There are a number of people who believe that it's dangerous. We'd like that number to be higher. In a survey we did in Minnesota, we had about half of adults agreed that impairment begins with the first sip of alcohol. We'd really like to grow that belief, right? Alcohol impairment just doesn't magically click at 0.08. It starts as soon as you start drinking. It's levels of impairment, and we need people to understand that. So these are examples of behavioral beliefs, and there are lots of behavioral beliefs, but they're basically beliefs about the behavior. Now, another set of beliefs are called normative beliefs. And normative beliefs are an individual's perceptions of what is common and expected about a behavior. So these are inherently social. A behavioral belief is me and the behavior. A normative belief is, hey, what's everybody else doing? And what's expected of me by others regarding this? So for example, we might have youth who believe that most students in their school drinks. This is a very common misperception that youth have, and overwhelmingly, actually, most youth don't drink. But if kids have the perception that most students do drink, it creates sort of an implied peer pressure to start them drinking. An example might be my parents do not want me to drink. This is what's expected of me by somebody who's important to me. Youth will say, yeah, what my parents want me to do will influence me. So this expectation of important others can influence us as well, and that's a form of a normative belief. Again, we can look at these in the context of traffic safety culture. 84% of Minnesota adults perceive that most people in their community had driven impaired in the past 30 days. That's false. Most people in the community had not driven impaired in the past 30 days. But if you have 8 out of 10 thinking that is true, that can really influence their decisions. It can also influence their decisions, for example, about intervening. You're less likely to intervene if you think, hey, I'm intervening on a behavior that everybody does. Who's it to me to stop this person? So these perceptions can be really interesting. We also have one that, about 8 out of 10 perceive that people who are important to them would completely disapprove of driving within 1 hour of using cannabis. That's good. Now we're worried about the other 21% who aren't perceiving that complete disapproval. But this notion and this set of beliefs about what others are doing, what's typical, and what is expected of me is very important. So let's look at a third set of beliefs. And these are called control beliefs. And there are a lot of beliefs that can fall as control beliefs. And this is an individual's perception of their general ability to engage or sometimes not engage in a behavior. So, for example, we might say, if I wanted to, I could go to a party and not drink. In other words, I have a sense of control about my ability to choose to go to a party and not drink. Other people might say, if I go to a party and there's alcohol there, I'm going to end up drinking. And it's really important to understand how control beliefs may influence a behavior, because that's going to really inform a different kind of approach that we might work. For example, if we have a student who says, I really don't want to drink, but if I go to a party and there's alcohol there, I just end up drinking. Then we're going to work on teaching them refusal skills or strategies they can use to avoid drinking, as opposed to just telling them that drinking is bad or harmful or different things like that. They might know that, but they need to grow their sense of control. Again, we can think about these in the context of traffic safety as well. So for example, 4 out of 10 Minnesota adults reported they were very or extremely comfortable asking a driver to stop reading or typing on a cell phone. Now, this is a really good example where overwhelmingly people recognize that typing or reading on a cell phone while driving is dangerous. And yet we still have about 6 out of 10 who are not very or extremely comfortable to say something to a driver who's doing it. And how could we build their comfort or capacity to do that so that we can engage more folks in growing safer outcomes, right? This is bystander engagement. This is where others can help us reduce risky behaviors by the few people who are engaging in them. So it's very valuable for us to think about these kinds of beliefs. Now, immediately comes up the question was, well, how do we change these beliefs? If they're so important and we need to grow positive traffic safety, how are we going to grow them? Well, we can think about any strategy or program, a countermeasure in traffic safety world, as an intentional experience designed to change beliefs. Behavioral, normative, and control beliefs. We want this strategy to come from a trusted source, right? I'm much more likely to potentially shift my own beliefs or question my own beliefs when I think that the source is trustworthy. And we really want to foster conversations. We want to get people thinking and talking about it. That's how you change beliefs, is when you get people talking. And sometimes those are conversations we have with ourselves, and sometimes those are conversations we have with others. And we want to avoid arguments. So let's quickly look at high visibility enforcement. Now, I'm not endorsing high visibility enforcement, but high visibility enforcement is out there. So we want folks to understand it through this lens. So what's it going to involve? It's going to involve increased enforcement and universal media. Why universal media? Because our goal is to change the beliefs about the perception of getting caught. And we want to increase that perception of getting caught among everybody, not just the few people who might be stopped or cited by law enforcement. We want everybody in the community to increase their perception of getting caught, because they might not do the behavior, but they might tell somebody else, hey, don't do that, you're going to get caught. We also want to have a perception of severe consequences. If the consequences aren't really severe or don't mean anything, people are like, well, I don't care if I get caught. That can lead to a reduction in risky behavior, like not using a seatbelt, which can reduce unrestrained crashes, which can reduce unrestrained serious injuries and fatalities, and thereby improving the consequence we're really focusing on. But it's really interesting to think about an effort like high visibility enforcement as a strategy, an intentional strategy designed to change beliefs, and designed to change beliefs among a large group of people. So again, our second tip is to change beliefs to change behavior. Easier said than done, but when we recognize this is our work, it can really help us be more effective with it. So I'm going to turn it back over to Katie to talk about the third tip.
Yeah, so Jay's been talking about how important these beliefs are in changing behaviors and ultimately consequences, and that our strategies really need to be these intentional experiences designed to change beliefs. So now I want you to reflect on this question for just a second here. You might be asking, well, where do we even get beliefs from, right? Where do our beliefs come from? Well, we might say that our beliefs are really based in our culture. And here I'll provide a definition of traffic safety culture. Traffic safety culture being the shared belief system of a group of people, which influences road user behaviors and stakeholder actions that impact traffic safety. Now I'm going to break that down a bit because I think that's a lot of words. but it's the shared belief system. So most people in this group really share these beliefs. And it's not to say that absolutely everyone shares these beliefs, but most do. Next, a group of people. And we can define ourselves in many ways as groups. We might say it's our community, it's our county, it's our state, right? It's our organization. But it's the shared belief system of a group of people that influences road user behaviors and also stakeholder actions that are impacting traffic safety. So if our work is to grow, traffic safety culture, growing protective beliefs that influence road user behavior and stakeholder actions, that ultimately improve traffic safety. And I think it's interesting, given what Jay's just been talking about too, is that if our work is to sort of grow this traffic safety culture, we might want to be starting to ask ourselves how we even observe culture in the first place. We all actually observe culture differently. We see this play out in a lot of the work that we do at the center. And over the next few slides, I'll go through them pretty quickly, but in the next few slides, I'm going to illustrate how our observations of culture, or how observations of culture in general, were coming through in some of the work we did a few years back in Minnesota. So an example of this, 65, so most Minnesota adults reported not driving within 2 hours after drinking in the last 60 days. However, 97% of respondents perceived that most adults had driven one or more times after drinking. And that's interesting because that's a huge number, right? 97% essentially misperceiving this norm. 84% of Minnesota adults reporting always wearing a seatbelt. However, 93% of respondents perceived that most adults in Minnesota did not always wear a seatbelt. So significant misperceptions here of the culture. And these perceptions matter. Here we can calculate a risk ratio. Minnesota adults who perceived that most speed half the time or more were 10 times more likely to speed half the time or more. And this is really interesting. I think what we tend to see, or it's just in general, like we as humans are really bad at observing our culture. We have significant misperceptions. We tend to misperceive what others are doing, what others are believing. And we know that these misperceptions are really important because they're beliefs, right? And we just saw in this behavior model that beliefs impact our behaviors. And our perception is everything, right? What we see as real is absolutely real for us. And as Jay said, it doesn't matter if it's accurate or not. It's real in our minds, and it shapes how we see things and what we believe, and of course our behavior then. People live with a lot of wrong perceptions, ideas, and notions, and when they invest their lives in them, it's dangerous. We all have misperception, and this sort of recognizes that it influences our behaviors. We need to be aware of our perceptions, which are beliefs, and if they're accurate. And I think it's important to start to be thinking about where our misperceptions come from, right? We get misperceptions in many, many different ways. You can start to brainstorm a list in your mind, right? We get misperceptions from our friends and from our families and the stories we hear in the media and the news and music and movies. You're probably thinking a bunch of others in your minds as well. We get misperceptions from a lot of different places. And this brings me to the third tip, which is part of our work, which is to correct misperceptions of culture. Again, we all have misperceptions about our culture, and I believe our work is to really understand what the current culture is, assess what the actual beliefs and behaviors are that are shared. Then we work to reveal those, to correct misperceptions of others, revealing what's actually going on in a way that really reflects the true culture that exists and corrects misperceptions and fosters hope, really. I think if you're anything like me, when I first really started thinking about growing, about culture in general and growing traffic safety culture, it can seem a bit overwhelming. Culture is big, right? Here is a broad definition of culture, not specific to traffic safety, but you can see the similarity here, the shared values and beliefs of a group of people that influences behaviors. It's essential in our work to improve health and safety, I would say in any topic area, traffic safety, many other topic areas as well, that we're thinking about culture and growing protective culture to support healthy and safe behaviors. And to do this, sort of to organize our work a bit, we'll use the social ecological model. The social ecological model, while it was sort of developed to help us understand how children learn, has a really broad application in public health. And I think it's been very helpful for us as we start to think about culture. Basically, what the social ecological model is telling us is that we as individuals don't operate in isolation. We sort of exist within these social environments around us, and that these social environments that exist around us sort of influence our beliefs and our behaviors. And we actually influence these other environments as well. We're influenced by our families and our peers, and our beliefs and our behaviors are influenced by the schools that we belong to or the work sites that we work for, the policies and norms that exist in these environments. We're also influenced by our communities at large. Our all of these different environments start to influence and shape our beliefs and our behaviors. And again, we have influence on them as well. But because these different social environments exist and are so important, we really need, as professionals, I think we really need to start be thinking about placing strategies at these different layers, because we now know that it's not enough just to change the beliefs and the behaviors of the individual, right? We live in this context of these different environments around us. We've got to be thinking about changing these systems around individuals too, so that these behaviors are reinforced and supported. For example, what are we doing? And Jay mentioned this earlier. What are we doing with parents and families? What are we doing with schools and with work sites? What are we doing to impact community policies and enforcement, right? Rather than just thinking about what are we doing to reduce driver behavior or impact driver behavior. And when we do this, when we start placing strategies across the social ecology, this is when we would say we're taking a cultural approach. We're starting to shift beliefs and behaviors of these different groups across the social ecology. These different strategies really support and reinforce one another for greater impact, and these impacts that are more sustainable over time. And this way of thinking can really be a transformation for us. This can really transform how we go about our work. Whereas before, we may have been very individual focused, asking, for example, a question that might have in the past been, well, how do I get individuals to wear a seatbelt, right? A very individual mindset, to one where now we might be asking, what are the actions I want to grow across the social ecology to increase seatbelt use? You can see these are very different questions. How do I get individuals to wear a seatbelt? Rather, what are the actions I want to grow across the social ecology to increase seatbelt use? What do I want families and parents to be doing? What do I want schools and workplaces to be doing, the community at large? And I'm going to show you an example of sort of what this looks like in practice, what it looks like to sort of engage across the social ecology for increasing seatbelt use. And this is actually from a project that the center is engaging in with 9 counties in rural Utah. So for example, yes, of course, we're asking individuals to wear a seatbelt. Absolutely. But we're also asking individuals to ask others to wear a seatbelt, making that ask of others around them. We're working with families to increase the rules and expectations around seatbelts, right? Do we have a family rule about always wearing a seatbelt? What about schools? Well, working with them to provide education and to promote bystander engagement on the issue. Working with workplaces to have seatbelt policies and training on those policies and regular reminders about those policies. Working with key leaders, knowing how key leaders are so important in communities. How are they advocating for strong policies? How are they engaging on the issue, providing them tools and support to help them do that? What about law enforcement, right? Part of this project revealed that law enforcement in these rural areas were wearing their seatbelt at lower rates than the general public was. So what are we doing to grow seatbelt use among law enforcement officers, but also encouraging them and working with them to consistently enforce the seatbelt? law and also advocate for this issue. So you can see how this is quite different than maybe a previous focus on the individual where we were just saying we gotta work with individuals to wear their seatbelt. This is a very different approach. And now this approach definitely takes time, but this is the type of approach, this cultural approach, where we're going to see that this is sustained long term. So bringing us to that fourth tip, which is that we really need to work to engage in strategies across the social ecology where we're taking this cultural approach, one that is much more likely to be sustained long term. So I wanted to leave us a little bit of time at the end. I hopefully I didn't rush through those final slides too quickly, but I want to thank you all for your participation today. We're not quite done, but I did want to open it up to see if there were a few questions that came in. I think I see a few of them come in, so we'll pause and we'll answer some of those questions. And then we'll tell you about a couple of upcoming things that you can participate in as well. So Jay, I'm going to open this back up to see if you have seen any questions come in.
Sure. So feel free to put questions. You can put them in the chat window or the Q&A box. We can see both of those. We know that we've shared a lot of content in a short bit of time. And our goal here is to really introduce some ideas to you, to give you some places where you can think, start doing some maybe new or refined thinking and look for more opportunities. Certainly some questions came up like, why do you think so many people in Minnesota perceive that most people in their community had driven impaired? And Katie was talking about some of those. So there are a wide variety of sources of these misperceptions. You know, the news can be, we hear about, obviously, the people who are driving impaired. It's not news to talk about the people who are not. We can certainly have situations where efforts to address impaired driving themselves may increase the perception that people have that a lot of people are driving impaired. So we're going out and saying, you know, we have an epidemic of drinking and driving, and that language can lead people to believe that everybody's doing it, when in fact it's a small group of folks who are doing it. They're causing a lot of harm. It's way too high. We absolutely have to reduce it. But from this cultural lens, it's not this notion that everybody is doing it. And so those beliefs can be developed in a variety of ways. Also, who you hang out with matters, right? If people around you, your peers, let's say drink and drive or don't wear their seatbelt or drive distracted, you may be more likely to do it because you think everybody does it, because everybody in your world seems to do it. So there are a variety of mechanisms that can really lead us to develop those beliefs. And we can also have that sense of growing beliefs that are supportive of things that we're already doing. So they can be confirming to us. So we engage in a risky behavior, and then we see other people engaging in the risky behavior, and that gives us sort of permission or a sense that everybody's doing it, when in fact, it's just a bias that we have. So any other questions or comments that you have? Very much the notion that somebody said, yeah, people associate with groups that approve of their behavior. And this is the whole power of culture, right? So how can we be intentional with growing those beliefs? Because people will want to be in groups that approve of their behavior. And so this is a huge opportunity for workplaces. And when we look at those those three kinds of beliefs, behavioral, normative, and control, normative beliefs can be very powerful in workplaces. What you're expected to do can have a significant influence on what you do, because obviously a workplace is an exclusive community. You can be removed from it. But that means we can also leverage workplaces to really work on traffic safety. And if we can build safer beliefs and behaviors in the workplace, folks will also tend to take those home and share those with their family. So it's really thinking again across that social ecology. How is the correction of misperceptions received in these groups? So that's a great question. Often there's pushback, right? There's resistance. There's, oh, everybody lied on the survey. So this is very common. And these are not any of these beliefs, but normative beliefs in particular are not beliefs that are changed overnight or quickly. These take sustained efforts, long term, and there can be real resistance, and sort of how you go about communicating it can matter. we recently did a project with the Pooled Fund on traffic safety culture looking at psychological reactance. So psychological reactance is that perception that people can have that if you're doing something that threatens their freedom, they can really push back. They can discount what you're saying. And there's strategies you can use to share information that decreases psychological reactance. There are definitely things you can do in your communication that can increase psychological reactance, which is not what you want. But a lot of that can go on, and we experienced a lot of that during the pandemic. So, yeah, so an idea of thinking about different strategies across the social ecology for something like seatbelt use. Hopefully that example does help you think broader about some of the things we're dealing with. We like that example because on its face, seatbelt use is a relatively simple behavior, right? When we're talking about impaired driving, it's very complex because we're talking about addiction and other challenges. When we're talking about seatbelt use, it's a little bit more straightforward. But it's interesting to take a simple behavior like seatbelt use and really think about, wow, there are a lot of different things we could do across the social ecology to address seatbelt use. And that's what we want to do. We really want to engage. We want to engage in a process where we can think about stakeholders, bringing in stakeholders from different layers of the social ecology who could say, you know, from my perspective, this is something we could do. And suddenly you've got a whole bunch of different strategies that really take it to a cultural approach as opposed to just an individual approach. Well, Katie, why don't we just hit the next few slides. So some upcoming events. We will have another webinar on September 22nd, so you can look for that. That's at noon Mountain Time. And that's going to be around aspects of leadership. A lot of this work does involve leadership and leadership kinds of thinking when we're trying to think about new ways of addressing and growing positive traffic safety culture. Also, if you're interested in sort of more depth, we offer training, which is more time than just like an hour. Our August Positive Culture Framework is filled up, so there are no slots there, but we're looking at planning one for the spring of 2023. So look for that. That's going to be on the East Coast, hopefully in Charlotte, North Carolina, and a face-to-face, so an opportunity to get together. And that's a much deeper dive. So that's a 2.5-day detailed exploration of these ideas, opportunities to really play with these ideas, and also wrap a whole process around this. So we just shared a few tips with you today, but there's a lot that we can go on in there. Some other things, there are other trainings that we offer. So those are available that you could reach out to us if you want to explore any of those. We also have something called Guide Service, where we work with you over a sustained period of time to build skills. We also do some work around assessments, surveys, and evaluation, because those are all going to be critical pieces to help do cultural work. And there are a number of free webinars which are on our website. So you can see the URL of our website, and you can go on there and look for those. You can also sign up for a newsletter and different things so that you can find out when different events are going on. So I very much want to thank you. Both of us want to thank you for your time and your engagement today. And even more importantly, we want to thank you for the work that you do. Traffic safety is a major public health issue. It's one of the leading causes of death and serious injury, one of the leading causes of years of potential life lost. So definitely is a very important endeavor for us to work on, and we hope we gave you some ideas to help improve your efforts. So thanks so much for your time today, and feel free to reach out via email or other mechanisms if you have questions in the future.
Thank you, everyone. Enjoy the rest of your day.
Take care.